Most people think chiropractic is about cracking your back when something goes wrong.
It's not.
And most people think they need to be in serious pain before it is worth seeing a chiropractor.
Also, not true.
Chiropractic is actually about how your body moves, how it handles load, how it adapts to the physical demands you place on it every single day.
And when those things are working really well, everything else works better. Your training, your recovery, your ability to sit at a desk all day and still feel like a functional human being at the end of it.
We've spent the last 3 weeks breaking down why backs stiffen, how flare-ups developed, and what habits build resilience. Today, we are going deeper. We are talking about what chiropractic care actually is, what it looks at, what is involved, and who it is for.
Not the version that people assume, the real version.
If you have been watching this series, you already understand a few things. You understand that stiffness is information, not just inconvenience. You understand that flare-ups don't come from nowhere. The cup was already full. You understand that resilience built through consistent movement, not just a single training session.
And at some point in that journey, the natural question becomes, okay, so what does professional support actually look like? What can someone do for my back that I can't do on my own?
And that's exactly what we want to answer today. Honestly and clearly. I'll be upfront about something before we get into it. I'm obviously biased here. I'm on off this clinic and I see our chiros regularly for my own care. So take my perspective for what it is, a personal one. But what I can speak to honestly, it's what I've actually noticed in my own body. And I think that's worth sharing.
And I'll bring the clinical side, what we actually assess, what we do, and why it works the way that it does, based on evidence and experience, not just opinion. Let's start by clearing up the biggest misconception. Chiropractic care is not just about spinal manipulation, and it's definitely not just about that sound, the crack, that people either love or they feel a little bit nervous about. Chiropractic is a regulated, evidence-based healthcare profession focused on the diagnosis, management, and prevention of musculoskeletal conditions, primarily involving the spine, but also the surrounding joints, the muscles, and the nervous system.
So it is broader than most people think.
Much broader. A good chiropractor is assessing how your body is moving as a whole system, not just where it hurts. And then also working on that system to support better function, better movement quality, and better capacity to handle physical demands.
Okay, and I think the crisis care mode is the one that most people are familiar with. Something goes wrong, you go to the chiropractor. It gets sorted, you leave.
Yes, that's one model, and it works for a lot of people in the short term, but it's not the full picture of what chiropractic can offer. The other model, which I'd argue is the real value, is structured proactive care. Understanding how your body is moving before things go wrong. Identifying patterns and compensations early, and also supporting the spine and the surrounding structures to stay resilient under the demands of your life and your training.
Which is exactly what we have been building towards across this whole month. The idea that your back was made to move, and the goal is to keep it moving well, not just to manage pain when it shows up.
So let's talk about what actually happens when you come in for a chiropractic assessment, because I think that people have a very vague picture of this. The first thing that we're going to do is take a detailed history, not just where it hurts and how long it's been hurting. We want to understand your lifestyle, your work setup, your training, your sleep, your stress levels, all of the things that fill the cup.
Which is why it makes a difference to a lot of healthcare experience. You feel like you've got 5 minutes and you need to get to the point very quickly.
Yeah, right. The history is genuinely very important because two people can walk in with the same low back complaint and have completely different contributing factors. And if you treat them the same way without understanding those differences, then you're going to get really inconsistent results.
So the history shapes everything that comes after.
It does. Yeah. So when we move into a physical assessment, and this is where it gets interesting, what we're doing is we're actually looking at the movement quality, how the joints move through its full range, whether it's restricted or where it's moving really well. Are there any asymmetries in the body and when it's loading? We're also looking at joint function. Are specific segments of the spine moving the way that they should? Or are there some areas that are feeling stiff and restricted, while others are compensating by moving too much? We're looking at the surrounding musculature, what the hips are doing, and also what the glutes are doing. Is there a pattern of underactivity or overactivity that's affecting how the low back is being loaded?
So you are building a map of the whole system, is that right?
Exactly. A map of the whole system. And that map is what drives everything else. The treatment approach, the exercises that we recommend, and the advice that we give about training and about lifestyle. It all comes from that initial picture.
And I think that's one of the things I personally value most about it. It's not generic, it's specific to what's actually happening in your body.
So once we have the big picture, what does treatment actually look like? The most well-known part is the spinal adjustment, which is where that sound comes from. And I wanted to demystify that a little bit. That sound is caused by changing pressure within the joints. It's not bones cracking, and it's not something being put back into place. It's a specific controlled force applied to a joint to decrease pain, as well as improve its function and its mobility.
And is it always part of the treatment?
It's not always part of the treatment.
Okay.
It's just one tool that we use in the toolkit. And whether we use it depends on what we've found in the assessment, what the person is comfortable with, and what's most appropriate for that person's situation. Other tools that we use include things like soft tissue or massage, working directly on the muscles and the connective tissues around the spine and the hips. We also use mobilizations, gentler joint movements that improve joint range of motion without the manipulation component. We can also use things like dry needling, which target specific areas of muscular tension really effectively, and exercise prescription, which is a really big part of what we do.
Yeah, the exercise piece, it's something I want to come back to, because that's been a really significant part of my own experience.
Yes, we can. But what I want to do first is talk about why this works.
Okay.
So the mechanism is essentially about restoring normal joint function and reducing the load on structures that have been compensating. So when a joint is restricted and not moving very well, the body works around it. Other joints move more than they should. Muscles work harder than they're designed to. And that compensation then creates tension, fatigue, and over time, overload. By restoring movement where it's been lost, the body can distribute that load a lot more evenly. The compensating structures then get relief, and that system as a whole then becomes more adaptive and resilient.
So it is not just about the symptom, it's about changing the underlying pattern.
Exactly right. That is the goal. Symptom relief is a part of that, but the deeper outcome is a body that can handle load a lot better and also recovers more efficiently.
I want to address something here because there is a sheer perception that chiropractic is for people with serious injuries, for older people or for people who have exhausted every other option.
There is, and that perception really undersells what we can offer. The people who get the most out of a structured chiropractic care plan are often active, health-conscious adults who want to stay consistent, people who regularly train, people who sit at a desk all day, people who feel the gap between how their body feels and how they want their body to perform. So essentially, people use it for pain, performance, and for prevention.
Which is basically for everyone watching this series.
It is. And for that group, chiropractic isn't a last resort. It's a proactive investment in staying consistent and performing well over the long term. Think about how seriously active people take their training programming, their nutrition, their recovery protocols. Chiropractic fits into that same category. It's structured support for the body that's being asked to perform at a high level.
And I think the analogy I always come back to is maintenance. You don't wait for your car to break down before you service. You service regularly so it keeps running well.
Exactly. And the body is no different. Regular assessment and structured care means that you're catching things early, staying ahead of patterns that then lead to flare-ups, rather than waiting until something forces you to stop. I want to spend a moment on the evidence, because I think that it's important for people to know that what we're talking about isn't just anecdotal. Chiropractic care for low back pain has a well-established evidence base. Clinical guidelines in Australia and internationally recognise spinal manipulation as an effective intervention for a range of musculoskeletal conditions, particularly low back pain.
So it is not an alternative medicine, is it?
It's not an alternative medicine, it's an allied healthcare. It's a registered health profession in Australia, regulated by AHPRA, the same regulatory body that oversees medicine, physiotherapy, and other allied health professionals. The evidence supports its use for pain management, improved function, and in combination with exercise and lifestyle advice, longer-term outcomes for people dealing with recurrent or chronic back issues.
And I think that matters because a lot of people come in slightly skeptical, which is fair. There's a lot of misinformation out there about what chiropractic is and what chiropractic isn't.
And the best thing that I have to say to someone who is skeptical is to come in, have an assessment, and ask questions. A good chiropractor will always be honest about what they can help with and what they can't. And if something's outside of our scope of practice, then we'll refer you to the right person.
Okay, so I want to share my personal experience here. And as I said at the start, I'm biased. I want to be clear about that right at the beginning. But I also think there's a really value in sharing my own experience, what I've noticed. So I see our chiropractors regularly for my own care. And the two things that have made the biggest difference for me personally, I stay on track with my recovery between training sessions and the personalized exercises. Because it is one thing to read about what exercises are good for your lower back resilience in general. It is another thing to have someone to look at your specific movement patterns and say, this is what your body needs right now.
Exactly. And that's the piece that generic advice online, it can't give you. Because it doesn't know what your hips are doing. It doesn't know which areas of your spine are restricted. It doesn't know what your training looks like or how your body is responding to that.
And for me, the CrossFit side of things has noticeably improved. So my capacity to train consistently without the same level of post-session stiffness, the ability to recover between sessions more effectively. I can't tell you that's entirely because of chiropractic care. There are other variables as well, but it's part of the structured approach to looking after my body that makes a real difference for myself.
And what I see clinically is that the people who commit to structured care, not just coming in when things go wrong, but coming in consistently and doing the work in between, those are the people whose bodies change over time. Not overnight, but the pattern shifts. The flare-ups become less frequent. The recovery in between sessions improves, and the body starts handling load more efficiently.
And that compound effect is the thing that's hard to communicate until someone experiences it themselves.
Exactly, it really is. Because the first few sessions, people often feel a lot of relief, which is great. But the real value shows up over months when they realize that they haven't been having flare-ups for the last 3 months, when they start to notice that they're recovering faster, and when they realize that their body is handling life a lot better than what it was.
And that's the goal, not just feeling better today, functioning better over time. All right, let's make this practical. If someone is watching this and thinking about coming in for the first time, what should they know?
The first consult is primarily about understanding you, your history, your lifestyle, your movement, and your goals. We're building that map that we were talking about. So come prepared to have a conversation, not just to describe the symptoms.
So what should people bring or think about beforehand?
So think about your history with your back, how long things have been going on for, what makes it better, or also what makes it worse, what you've also tried in the past, what your training looks like, what your work setup looks like, as well as any imaging that you've had. The more context that we have, the more useful that assessment becomes.
Okay, so what about the ongoing care side? What does that typically look like?
So that also varies depending on what we find. But generally in the early stages, what we do is we typically see someone more frequently to make progress with their movement restrictions and the underlying patterns. And then as things improve, that frequency reduces. And for people who want to maintain and stay ahead of things, periodic check-ins make a lot of sense. It's not a one-size-fits-all approach. It's built around what each person needs and what their goals are.
And I think the question worth asking yourself is, what would it mean for my training, for my work, and my day-to-day life if my back is functioning the way it should? Because for a lot of people, that is a significant question. The impact of a back that moves well and recovers well goes far beyond just less pain.
It really does. It affects everything. Energy levels, mood, performance, confidence in movement. When the body's functioning well, everything else gets easier.
We've covered a lot of ground today. And across this whole month, we've built a picture of why the back stiffens, how flare-ups develop, what habits build resilience, and what chiropractic care actually offers. If you have been nodding along to any of these, I want to say something directly. Understanding this information is valuable, but understanding alone doesn't change the pattern. At some point, the most useful thing you can do is get a clear picture of what's actually happening in your specific body and act on it.
And that's exactly what a chiropractic assessment provides. A thorough, specific, and honest picture of how your spine is moving, what parts of your body are compensating, as well as what structure support looks like for you. Not a generic plan, not advice pulled from the internet, a plan built around your movement, your lifestyle, and your goals.
At TT Chiropractic and Remedial Massage, our clinic, that's how we approach every single patient. We start with understanding. Then we build a plan that actually makes sense for that person. And if after the assessment we feel like there is something outside of our scope, we'll tell you honestly and point you to the right direction. That's what good healthcare looks like. Your back was made to move. We've said this all month, and we mean it. The spine is not a fragile structure that needs to be protected from life. It's a dynamic, adaptable system that responds incredibly well to the right input.
It is. But when that's been dealing with years of sitting, accumulated tension, recurring flare-ups, and compensating patterns, it needs more than just general advice and good intentions. It needs someone to actually look at it properly.
So, if you've been managing your back on your own and you are ready to actually understand what's going on, click in the link in the description and book your consult with us. Here's what happens when you do. You will have a detailed conversation about your history and your goals. We will assess how your spine and hips are actually moving. We will identify what's contributing to the stiffness, the flare-ups, or the restricted movement, and we'll give you a clear, honest picture of what a structural support looks like for you.
No pressure, no generic advice, just a proper look at what's going on and an honest conversation about what we can do.
Your back was made to move. Let's make sure it has got everything it needs to do exactly like that.